Imagine a surgeon cutting into your body while you're fully awake, screaming. Now imagine they wrote instruction manuals for it. Welcome to Victorian surgery. Before anesthesia was widely used in the 1840s, surgical manuals gave step-by-step instructions for performing operations on fully conscious patients. And the details are absolutely nightmarish. These weren't just medical textbooks. They were survival guides for both surgeons and patients. Speed was everything. The best surgeons could amputate a leg in under 3 minutes because patients would die from the shock and pain. The manuals describe in clinical detail what to expect: patients thrashing, screaming, begging the surgeon to stop. Some books literally instructed assistants on the best ways to physically restrain patients during procedures. They recommended strapping them to tables, having multiple strong men hold them down, or even using specialized restraint devices. One manual casually mentions that surgeons needed steady nerves and a deaf ear to the cries of the patient. Another describes how to identify when someone has passed out from pain versus actually dying, because both happened regularly on the operating table. The illustrations are even worse than the text. Detailed engravings show tools that look like torture devices: bone saws, amputation knives, trepanning drills to cut holes in skulls, all used on conscious people. Patients would literally rather die than undergo surgery, and many did choose that option. Robert Liston, one of the most famous surgeons of the era, was celebrated for his speed. He once amputated a leg so fast, he accidentally cut off his assistant's fingers too. Both the patient and assistant later died of infection. When ether and chloroform were introduced as anesthetics in the 1840s, some surgeons actually resisted. They argued that pain was necessary, that God intended surgery to hurt, or that patients needed to be conscious to survive. The early anesthesia manuals are almost giddy with relief. Surgeons wrote about how they could finally take their time, be precise, save more lives. They described the silence of the operating room without screaming as eerie, because they'd never known it before. These Victorian surgical manuals still exist in medical libraries today. They're studied not just for medical history, but as reminders of how far we've come and how recently surgery was literal torture. The next time you go under for surgery, remember, you're experiencing something people 200 years ago would have considered an impossible miracle. Modern medicine is amazing. Victorian medicine was a horror show.